that.
Yeah. But that was the whole thing. Is like if you got to be careful with the practices because once you get locked into a contract, it could exclude you from being able to work in the state. Or even
That's
if
right.
you go through a certain agency that has a certain region, they can block you out. So that's why a
Wow.
lot of doctors change states when they change practices.
Okay.
They
Well,
usually get you out of the woods. Usually,
wow. Oh, when you change states. Oh,
yeah.
wow.
Now the telemedicine may change the game because then it's like 50 states. It could be.
Oh, wow. So you might have to leave the country.
Yeah,
Good
or just
grief.
work, yeah, outside of their network or whatever. It'd be like T-Mobile or whatever. You're a psychiatrist out of the network. So,
So, so, so everyone, welcome. This is the Robaer Report. I'm your host, Robaer Washington. Today, we will be introduced to one of my good friends of pretty much, it was 18 and a half years now, Dr. Richard Turner, MD. Okay, how you doing today, Richard? Dr. Turner?
I'm good. How you doing, Robert?
I'm doing well. Thank you so much. So this is the Robaer Report. We're going live on Facebook. We're going live on YouTube. And welcome for those who are viewing in the moment, for those who will view in the near future. At the bottom of our screen, we have National Suicide Prevention Lifeline. There's a 1-800 number. Okay. Um, this is Black History Month. And for Black History Month, my goal here at the Robaer Report was to focus on mental health, no specific groups, just mental health in general. I've had a licensed social worker on, but I had a book publisher on last week, which not so much mental health, but hey, people like to read, so she wanted to come in to tell her story. Today we have a medical doctor, a psychiatrist here to speak with us about what he does in the field of psychiatry as a practicing psychiatrist, and who has the tenure behind him, who has the credibility behind him, who has the academics behind him, who has the awards behind him. Okay, this is my good friend, Dr. Richard Turner. Dr. Turner, give me 1 second. I'm going to put up need help with life struggles. This is for Baltimore. If you're having issues, if you're experiencing a situation that you feel like you need to talk to somebody, if you're in the Baltimore area, there's 443 number. You can definitely reach out to that organization. They will provide you with some assistance because I am a staunch proponent of getting some mental health work if you need it. If you don't think you need it, why not just go see somebody to make yourself even better than you might think you are? All right. So, my friend Dr. Richard Turner, we met at Howard back in 2003, and we've been friends ever since. Never any hiccups on the friendship. Uh, and at some point, oh yeah, he's also from Louisiana. He'll mention that. I'm from Mississippi, so when we met in college, we were like real close, and then we
yeah,
were real close. Uh,
the
he
southern
has
connection.
what to say?
The southern connection.
That Southern connection, and so he decided that he was going to spend his time as a professional in psychiatry in the state of Louisiana, which he loves. He's at Tulane now, Tulane University School of Medicine, where he's a assistant clinical professor of psychiatry. He's also had his fellowships and residency, as well as internship at Tulane. So Tulane is very important to Dr. Turner because he has spent an incredible amount of time learning from this institution, and they've gifted him specific skills that he's able to take into the world, and he's able to bless us with his skill set. He has his medical license for the state of Louisiana. He's board certified as a forensic psychiatrist. He has he's even certified. He has medical license with the DEA. He has a controlled substance license, controlled dangerous substance license, and he's a published author. And he's even won awards in the field of psychiatry, as well as attended numerous conferences. And he's involved in community service. I only say that because I want to put him on a pedestal because of the level of research and the diligence that he has placed in that he has sought out in his discipline. Dr. Richard Turner, say hello to everybody, man. Once again, say hello to everybody. How's everything going?
I'm good. How's everybody out there? I hope everybody's doing well and they are taking care of their mental health. It's a lot going on in the last 2 years because of COVID. The world kind of changed. The way I practice medicine has changed. The way I interact with my family has changed. I've only been able to see my parents twice in the last 2 years because of a lot of the COVID stuff. Because I have to protect my patients. So if I travel and they get sick, I don't want to be the reason they get sick. So I've had to kind of stay close to a core group of people and go through all the precautions, wearing masks, washing my hands. I wear a mask pretty much all day, every day. It's weird when you're seeing patients that way because that smile, that feedback is very important in connecting. But I'd rather be able to see him smiling later than to see him in the hospital. So
that's right.
So it's been weird though. It's because that's one of the things about psychiatry and medicine in general is that interpersonal thing that you miss out with somewhat with the mask. But I've learned that now we see things in people's eyes that you didn't notice before when they're looking in their face. Now you see it in their eyes. So it's just changing the way we do it. But we're getting there and we're learning. Hopefully this will be over soon so we can go back to the way we were.
That's right. That's right. And you know, Dr. Richard or Dr. Turner, I'm so used to calling you Richard. I'm going to call you Dr. Turner as much as I can just think about it for the show.
And I've been Richard for a lot longer, but
I got you. So Richard, so you won an award, and I'm going to bring this award up because the what you just told us was that you care enough for people that you have limited who you are around so that you can protect your clients. Yes. All right, you won an award called the Robert Columbus Lancaster Prize in Psychiatry. All right, we discussed that award. I thought it was some pretty exciting stuff. Please, for people who know about the Robert Columbus Lancaster Prize, and for those who don't know, lead us in a discussion about what it took to achieve that award in psychiatry.
So when you go into residency, you're the bottom of the totem pole. You have a bunch of people you interact with, and you don't think they're really paying attention to what you do. You don't really think that because you spend so much of your time in residency trying to learn how to be a doctor, learn how to be a good doctor, and learning how to connect with patients, that kind of becomes your focus. But apparently, at Tulane, they have this tradition where they try to give an award for the resident, and we give it every year. Not that I'm a faculty member, I'm part of the committee that can submit votes, but basically the education committee is the dominant committee, and that's mainly the professors that train us directly. And also there's a larger, more the alumni of the program that are faculty that are higher ups that we don't necessarily interact with, but they hear things and they get feedback. So through my 4 years, I had the honor after the 4 years when we had our graduation ceremony, they award different prizes for different things that people do. And I was surprised when they gave me the Lancaster Prize because the guys that came before me and the women that came before me that got the prize were exceptional doctors, but you don't think of yourself that way. You're just operating as a doctor. So the prize is for the resident that they saw in training in psychiatry at Tulane. So when the people from the medical school come together, they try to decide who is the person that was most caring towards their patients. And I was honored because that's the thing I took the most pride in as a doctor, and I still do, is patient care, having a connection with your patients, being able to collaborate with them. So it's not passive. They're not telling me, and I'm not telling them. We're working together to solve these problems. So it was I almost cried. I never really do get emotional, but that was one of those moments.
You don't get emotional, everybody. I'm sorry to cut you off. Richard is not an emotional person. So when he said that, he says it from the heart. Continue.
Yeah, my family was there, and I was like, they were surprised. I was surprised. The picture looks like I'm out there. I was like, what? And it was an honor because I used to sometimes get in trouble when I was a resident because they'd be like, you're spending too much time with people. Like you're getting there early and you're seeing them before the clinic's completely open. But I had patients with jobs, but they still wanted to come see me. And maybe I helped them find a job. Like we helped them, we worked through it. They got confident, they got a job. I'm not going to make them lose the job or miss their job to come see me. If I was flexible, if I could be there at 6:30 to see them before they have to go to work at 7:30 or 8:30, I would do it. Often a lot of my patients have my phone number, which a lot of psychiatrists don't do. And people think, oh my God, it's a really scary thing. But the reality of the situation is most of your patients, they're not going to call you when they're not needing anything. And most of the time when they call you, it's just routine stuff to let you know they're going to be late. Sometimes they just have quick questions about their medications, and you could address those things. And sometimes it's really to just get through to you because they can't get through the normal process of getting an appointment. and sometimes I'm able to do what they need me to do quicker. So I always was open. Like it was one of those things where I often found myself in a situation where everybody at Tulane I work with is caring, but it can get where there's the time management part of medicine. And they focus on that just so long term. As far as your mental health as a doctor, you can't burn yourself out working all the time. But
Okay.
being able to spend that extra time, being able to sometimes I pray with my patients, sometimes I talk with their families, sometimes I just let some of the older veterans just vent things that they never really got to say and open up a forum where they could be themselves without judgment. The only goal is to try to help them be the better them. So it really touched me to be able to be appreciated, and that work that I did filtered back up to the powers that be that mostly don't see what we do, because our interactions in psychiatry with our patients are very personal, is very individual, and usually for that to get out, that meant that somebody recognized that I was spending the time, and the patients must have been given the feedback that they gave to me, and it was getting to my supervisors through the secretaries and through other people. And also they go off of how you talk and discuss your patients. Some people can get really clinical. I almost try to paint a picture of who the whole person is. So even when the person was supervising me, they got more of a gist of more than just a person as an illness, but the person in their world that they live in and what they're trying to achieve through treatment.
Okay. Richard, I mean, I'm hearing you talk about this level of care that you have for your patients. And in our previous discussion, you mentioned that you are a forensic psychiatrist.
Yes.
All right. From what I know, with my limited understanding of forensics, is that forensics is the field that is supported in the court of law when there's a trial. That's the only thing I know about forensics. I have no more ideas about it. But you're a forensic psychiatrist. Tell us about that.
You know about as much of it as I did before I became a resident and before I decided to really look into it, because even as a psychiatrist, most people don't know what we do. Most doctors don't know what psychiatrists do, because we're kind of out there in this weird place where other doctors don't deal with us until they get a patient that has a psychiatric problem. And then all of a sudden they're like, hey, mental health. But forensics is a little different. This is the thing that was a challenge for me, because like I said, the empathy, the connection is the personal, the rooting for your patient thing is what I love about psychiatry. Forensics is a little different, because this is like where psychiatry meets the law. And in that capacity, I'm just a expert witness. I am, unlike some states, Tulane, we actually treat the patients at the forensic hospital and we do the court stuff. In some states, you would treat the patient at the hospital and another psychiatrist would come in and do consultation. What they do at the jail is we usually have another doctor or another psychologist that comes, and when we do our final evaluations. But forensics basically is where psychiatry meets the law. In forensics, outside of forensic psychiatry, forensic medicine, like a forensic surgeon would be a person that, say somebody had a bad surgery and they needed somebody to explain in court during a lawsuit, did this doctor do something negligent, or was this something that just happens? Can you explain to the court what this surgery means? So in my case, I'll get a patient, they'll be schizophrenic, they're charged with a crime. I'm explaining to the lawyers in layman's terms what schizophrenia is, what a hallucination is, what a delusion is, what depression is, what anxiety, because a lot of the popular understanding of these things aren't exactly the mental illness. So even mental illness in itself, there's different degrees of mental illness. There's what they call severe mental illnesses versus, like, severe depression is a severe mental illness, but depression in general is not necessarily a severe mental illness. There's mild, moderate, severe, so schizophrenia, PTSD, bipolar disorder, those the schizoaffective disorder, which is a combination of bipolar and schizophrenia, which is why when you see a lot of people who are bipolar or schizophrenic, they say they have bipolar schizophrenia, because usually depending on how they look when they came to the hospital, they got different diagnoses at different times. So what I do is I explain what this stuff means and how relevant it is, whether sometimes it's if the person is competent. So mostly what I do is competency, which is, can you speak for yourself in court? Do you understand the standard is set by the law? So we had to learn a lot of constitutional law cases. They call the landmark cases. So the BEAR standard is what they call the Dusky standard, which is, do you have a rational and factual understanding of the law? And can you help your lawyer with a reasonable degree of rational understanding? So before that, the standard was, what's your name? What day is it? How you feeling? What do you know where you are? Okay, well, you can decide whether you're going to plead guilty to a crime or not. They turned out that didn't work so well because somebody might know all of those things and be completely not living in reality otherwise. So what we do is we evaluate them using some standard measures, and a lot of it is our clinical judgment. We talk to them, we interview them. You can get a good idea how somebody's functioning by the things that they say. Mental status examination, which is just asking various questions just to get a baseline. And then when they go to the hospital, we treat them for their mental illness. If the reason why they're not thinking clearly is because they need medication to calm down, if they're manic, they're off meds, or maybe they were exposed to some drugs that give them symptoms, then we treat them, they get better, they get to go back, we test them, we send them back to court, the court tests them, they confirm it. Sometimes they call me in to testify, sometimes they just go with the report. And then the person's able to go forward in the criminal justice system just like anybody else. If they can't, then they wind up coming back to the hospital, we try it again, and eventually we have to sometimes commit people because they can never face trial. But it doesn't mean they didn't do it, doesn't mean they did do it. They're in a different position. So then they go into the civil treatment-based model where we just try to get them as good as we can so we can get them to function. Because some people, unfortunately, get stuck in these places. And some of them, 20 years later, some of my patients have found the right medicine that didn't exist 20 years ago, and they walk out the door. Other patients, it's a process, but we try to provide them as much support and resources as we can. Of course, our country has a limited mental health system, and Louisiana and Mississippi too. We all have our challenges, but we have dedicated people, and that's the thing that matters the most. You can get a lot out of a little if the people are all on the same page, and that's what we try to do in my work and with the people I'm blessed to work with at the state hospital, because they're underpaid, overworked, and more valuable than people can really appreciate.
Okay. Wow, Richard. I mean, you're showing a level of care for the patients. You're also showing a level of care for the discipline. You're then showing a level of care for your coworkers, for those who are working in the hospitals with you, and I'm sure your students that you're working with see that level of care as well. You know, and this goes kind of into my next question for you. So when we talked, you told me about you had to do your undergraduate. You actually completed a master's degree.
In
African American Studies, and you went to medical school, residency, and fellowship, and then you went to I don't want to mess it up. Fellowship.
The process is I went to Howard for undergrad, which is the foundation. It's the thing that led to the mentors that led me to where I'm at. Like the reason before I even started going to psychiatry, the person I talked to is a person that me and you both know, Dr. Philip Murray. He's a child and adolescent psychiatrist, Howard alumni, Mr. Howard, alpha, coolest dude in the world, man of God, just a wonderful person, one of the most beautiful people I've ever met in my life. He went to Medical College of Georgia, trained at Harvard, did residency, did a fellowship in child and adolescent, and he just continues to just drive. And he advised me when I was going through it. So it wasn't I was going through it blindly. I got to talk to one of the people I respected the most. Ironically, he's like a big brother to me, even though he's 8 days younger than me, because he went to college at the age of 16. He was brilliant, perfect SAT, just wonderful guy. He mostly emphasized that the education piece is the hard part. The getting into med school is the hardest part of becoming a doctor. The rest of it is how much you want to work to maintain it. But the hardest thing to do is to get into medical school because it's extremely difficult. A lot of people take long journeys where they have to go through West Indian schools, where they go to West Indian schools or come from overseas, and it makes it harder for them to match. I was blessed. Howard prepared me well for two things. One, academically, and two, how you interview so you can make sure you use your brain. You can sell that brain because everybody's trying to sell their brain to get into medical school. So if you can sell that brain, you'll get more opportunities, and it opened a lot of doors. I chose to come back to Louisiana because two reasons. When I left to go to Howard, I didn't think that – I always said growing up in New Orleans, everybody gets a degree and they go away. Everybody in New Orleans moves to Houston or Dallas or Atlanta. They make more money. And the thing is, it leaves behind kids like me who didn't have a lot of examples of doctors that look like me because all of them are in Emory. All right. And I had some black doctors because New Orleans is a very large black city, kind of like Baltimore, D.C. area. So you see them. But one of the things that always is important for us to remember when we're educated. It's a process, but like everybody takes a different path. I didn't do the typical thing. Most people do 4 years of college, med school, and I did African American studies because at the time, one, I didn't think I was mature enough to be a doctor when I was 22. And two, I was like, do I want to teach? And if the only thing I wanted to teach was about my history and my culture, because I felt like even though I grew up in a city with rich history, and Howard is basically a Black history museum on steroids, I felt like I needed to know more. If I would say, people say, I'm going to go out and help the community. But if you don't know what the community wants, how are you helping? Right. You'll wind up getting lost in all of the nuances, but also it allowed me to grow as a thinker because graduate school makes you write, makes you critically think. It pushes you. It's not regurgitation. And that's become valuable. And a lot of the things I learned about culture helps a lot when you're dealing with intercultural communication in medicine, because a lot of things are lost in social class and differences in races and age groups differences and all of these things you kind of learn intersectionality. You get exposed to that in graduate school. You're not getting exposed in med school. We talk about it, and it's become more and more important in recent years because the inclusion, diversity, the EDI, they call it inclusion, equity, diversity, and inclusion. That's becoming a thing. But I didn't really need it as much as some of my colleagues because it's in my background. So it helped me in a lot of ways. It helped me be able to find ways to connect with patients that I never thought I'd be able to connect with. So, but you do the 4 years. The basic formula is 4 years of college, 4 years of med school. Residencies range from 3 to 7 years. 3 years is pediatrics, family medicine, internal medicine. Longest residency is neurosurgery, is 7 years. General surgery is 5, radiology 5, psychiatry, OBGYN, pathology is a 4-year thing. I did 4 years of residency. The intern year is your first year. It's more of a general year. In psychiatry, it's more of a focus on some. I did peds because I thought I was going to be a child psych, but you can do internal medicine. We did adult neurology, and then we started doing some consult liaison where how does psychiatrists help other doctors in the hospital? Because if somebody has surgery, they still might be schizophrenic, and the surgeon doesn't know, you can't cut it out. So they have us come in to help either communicate with them and their family, help them break difficult news, help treat people who get delirious from the procedures, because delirium is one of our things we treat, which is when you get sick because something that happens in the process of getting surgery or getting sick throws off your chemical balance in your brain. And these people have this certain syndrome where it can be very deadly, actually. But usually a lot of people who are in old folks' home actually have delirium, but usually from UTIs, because the older you get, the more easy it is for you to become delirious. And it's very treatable, but a lot of times it goes unnoticed, particularly in people who are schizophrenic or already have dementia. But your quality of life can completely change, and their ability to interact with their families and their level of disability, and the longer it goes. So they call us for that. But other thing we always do is we do emergency psych. We see people who come in off the street, get picked up by the police, or get brought in by their families. So that's kind of what you do. And as you go further in medicine, you just get more and more. Medicine's about repetition and supervision. So you're not just out here freewheeling by yourself. You're getting the benefit of all of the doctors that are ahead of you, who treat you, the residents directly in front of you. And it's almost like an apprenticeship, like in unions with like trade unions. You're apprentice, and you get your mastery, and you get cocky, and you start thinking you know stuff, and then something will happen, and you go back to your OG doctors, and they tell you,
Okay.
A lot of OG doctors, and those are the ones that you learn the most, because they remember when we didn't have all these fancy tests, we didn't have all these fancy options in medicine. They just had to deal with people with what they had, and they have so much to teach, and more of learning from seeing and listening. That's the key. Like learning to listen, which is the hardest thing for anybody that's a doctor to do, because they say the average person cuts somebody off within 30 seconds. Most doctors is within 10 seconds. But that's because their mind is turning, and you learn a lot of that, and you learn how to through the process, you learn to be humble, because humans are way more complicated than anything you can learn in a book. And I learn more from my patients probably more than anything else in the world. They've taught me about life in ways I never thought. They've taught me about myself, because you see yourself a lot in people. So there's a lot of universality in human experience, but there's also some just people who could be completely psychotic. They'll say something to you, and you're like, "Whoa, that's actually brilliant." And that's one of the favorite things. I was like, it's never a dull day at my job. It's never a dull day.
Well, so all right. With that said, right. All right. One of the things that I've thought I knew about psychiatrists was was that they enjoy prescribing medication to people. That's one of the things that you hear when you hear about in the mental health field when it goes toward the psychiatrists, that's what they do. You go to psychiatrists,
Mm,
not much talking, we give him medications. All right. And that's from what I understood, that's popular knowledge. I'm not talking about the discipline, that's
yeah,
popular knowledge.
of
All right.
course.
So if I may ask you, in your professional opinion, what is your take on medication? And
So
can patients thrive without having to take the medication from a psychiatrist?
so So honestly, the thing about the pill pushing is better than the previous stereotypes, which was we were electrocuting people with jumper cables, like in that
Right.
movie We Flew Over the Cuckoo's Nest. So that's a step in the right direction. But just like all doctors, we don't want to give anybody medication. I never go to people's houses and knock on the door and try to shove pills at them. And 99.9% of doctors do not have a relationship with a pharmaceutical company, no matter what YouTube says. It's not the case.
Okay.
I wish I did own a part of a pharmaceutical company. Then I'd be flying Robaer to do my interview somewhere in Dubai. But
Right,
we're not
right.
in place. So most of our patients, it depends on the disorder. So if you have depression and it's minor depression, mild depression, you get depressed, a lot of times the first line treatment is therapy. A lot of therapy is cognitive behavior, which means a change in the way you think and the behaviors that those thoughts generate.
Okay.
The other way, the most common cure for depression, or at least a way of staving it off, is exercise. So I try to tell all my patients to exercise. I try to tell myself to exercise. That doesn't always work. But exercise is one of the most effective antidepressants that exists. And because just being active, being outside, moving your body, it triggers endorphins. That's your natural antidepressant. That's the
Okay.
reason why when you work out, you feel sore, but you feel good. It's because those endorphins, that's your body releasing these cannabinoids, which is like what marijuana does, that you have a little bit at your brain. Everything we interact with, our body can do that. It's just you
Okay.
have to do things to your body, feeding it proper food. We talk about diet a lot. We talk about substance abuse because if you have depression, you might be depressed because you drink every day. And I've had
Mm.
people stop drinking and they're like, walk out, and I worked in substance abuse programs, and it's almost like they'll come in and it's like, are you on drugs again? Because they just seem awake. This guy told me for the first time, I wasn't rushing to have a drink. I actually spent time talking to my kids and I got to enjoy it. Um,
Wow.
so, because the alcohol had become like a cloud that was hanging on you, because that's depression. Anxiety is the same. A lot of people learn breathing exercises, meditation, yoga, Tai Chi. All of those things can release anxiety. Boxing classes. Some people mix martial arts, getting that aggression out. With kids, I say play sports. Get your kid. If you have a busy kid, he needs to be running track. He needs to be jumping rope. He needs to be doing things with his body, because everybody is not a kid that can sit in a chair, and that's fine. There's great
Right.
athletes. There are people who are construction workers because they can be outside shoveling and moving stuff all day when another person would go crazy doing it. So
Okay.
it's lifestyle modifications, being around the right people, um,
Okay.
leaving a job when it's time. There's a lot of things other than medicine. Now the pills are important and the shots and all those things are important when that alone doesn't, when the lifestyle modifications and the therapy alone doesn't work. The research says, particularly for serious major depression, bipolar, schizophrenia, both psychotherapy or PTSD, anxiety, a combination of psychotherapy and medication tends to work better.
Okay.
Sometimes you can get both in one person because depending on the structure of the practice and the setting, the doctor may be able to do some psychotherapy and medication. I try to do a little bit of both. But usually most psychiatrists have go-to therapists that they have connection with. And the best thing is when they're in the same building. So
Okay.
they can talk about you to each other, because the therapist may notice that your medicine's not working, or you're too sleepy, or you're too flattened out. Because sometimes people take a medicine, when they come in, they're worked up. And then when they get the medicine, they're
Okay.
and they may have needed that higher dose 2 years ago, but today they may not need it. They may not need it at all. And so it always a big thing to get out of it with doctors, and any kind of doctor, If you don't like your medicine or you don't understand why you're taking it, ask them. The word doctor means teacher. It comes from the Latin word docere, which means teacher. So if they're not teaching you why they're giving you something, they're not doing their full job. And a lot of people don't want to know. A lot of my patients are like, give me some pills, leave me alone. I got to go work. But other people won't ask. And most doctors, if you ask them what the medicines do, they'll love to nerd out with you on it. They're happy to do it. It's just nobody usually asks because it just seems like mystery. It's like I always say it's like the Wizard of Oz. Nobody knows what's going on behind the machine. A lot of times, I'm willing to definitely explain it. And I'm also willing to talk to them about options that are alternative options, because there are herbs and things like St. John's root, and people take ginseng and ginkgo for more energy. Those are all things that as long as it's not making you sick, your coffee, your green tea, your whatever, go for it. But if you are doing that, make sure you tell your doctor, because unfortunately, some of those things have some of the same qualities as medications, and you put them together, we don't want you overdoing it. So that's the reason why sometimes doctors ask you about what herbs and stuff you take, because you may not need this medicine if you're taking this thing. Like if you're getting melatonin or sleep, or you take chamomile tea and it helps you sleep, then you don't need the Ambien. You may just need the chamomile tea. And we'd rather you take the chamomile tea because one, it's cheaper, and two, it's natural. So if there's anything natural you can do that's effective, I tell people go for it, go for it, go for it.
Okay. So all right. So I'm gonna hop into another question about client-doctor relationship. All right. How comfortable? I mean, if this is in the literature, if this is what you learn in your textbooks, or if this is what you're learning now, how comfortable do you have to be with the client in what we talked about a term, therapeutic relationship? How comfortable do you have to be with them to get them to a point where you all can discuss if they need medication or not need medication? Like, is it just something that you automatically do? You walk in with your clipboard and then you say, okay, you need medication, have a good day, bye? Or do you?
It depends on the patient. Some of them come in, they've already been seasoned and they know what they need, and they just moved to New Orleans and they just need a doctor. So they know what they were taking. They're going to get it. Some people have been treated, unfortunately, had they been treated since they were small children because they've been through a lot, and they have been through a lot of different medications, a lot of different doctors, and they have a lot of distrust. And that takes time to build. Some people were raised with the stigma that you don't need nothing wrong with them. My favorite thing is the most common diagnosis in the Black community is ain't nothing wrong with that boy. Something wrong with that boy, because we're talking about the boy. We don't just talk about, we're not talking about how great he is at basketball or how wonderful he's doing in math. So it takes time to build rapport. So a lot of times when I see people, they do want something because they're in immediate pain. It may not change emotional pain. So it may not, like if somebody's not sleeping, they may not need something to help them sleep forever, but I'm not gonna let them walk out my door if they came in to get help sleeping, if I can help them sleep, barring them having some reason, because there's some medical conditions you can't give people sleep medicine. You can't give people certain sedatives when they're on pain medication because of the risk. But if somebody's having problems sleeping, having nightmares, or their anxiety is keeping up, yeah, I'll offer them something. But sometimes they're like, I don't want that. And I was like, well, we can try these behavioral interventions. So there's cognitive behavioral therapy for sleep. There's I commonly, and sometimes I do this when I get somebody who comes in, I don't know them, but they're on 10. We do meditation exercises to calm them down. And it's short. Sometimes it's only like a minute or two for them to be able to settle in, because seeing a doctor makes a lot of people nervous, and seeing a psychiatrist makes people really nervous because they think I'm just going to be like, put him in the hospital. And that's not going to happen. That's one of the things I hate the most about my job. I hate taking a person's freedom away. Only time that's really reserved for when people are psychotic or violent or suicidal. And that's to give them some time to not hurt themselves until they feel better enough to make a better decision. But most doctors hate that. Like as a psychiatrist, I hate taking people's freedom away. But I also love seeing them walk out the door happy and healthy and understanding what's going on. So it takes a while. And sometimes the connection for me will come from the fact that we like the same basketball team. And that'll get started a conversation. Or they're grieving something, and I'm able to we start with that, and we work towards whether they need medicine. Some of my patients, they never needed medicine, they just became therapy patients. So we just do therapy, come check in, and I like that because it's therapy is one of those things that's a lost art these days because of the way psychiatric, way medicine works, because we're medical. MDs are medical. So we fall under the medical constraints of insurance companies and the way they set up these protocols. But when you do get to do therapy, we're trained to do it as psychiatry. We're trained on, that's part of our training. We kind of marry the biology with the psychology, with the mental, the concepts are melded together. So we're a different kind of doctor in that way. We don't just do this is a flow chart. It's more of a balancing what the person needs. Because like I said, some people don't need medicine. There's no medicine to make somebody not grieve. We want you to grieve. We want you to grieve in a way where you grow and you're able to process the grief in a way that doesn't debilitate you and doesn't make you hold you back. We don't want to just drug you up so you don't care, because you do need to deal with things to grow as a person.
All right. Okay. So all right. So in this interview, we touched on a variety of topics, and I'll put them into categories. Some of these topics, in my opinion, have focused on care for the patient. Other ones, what we discussed in the very beginning by listing your credentials, I would like to say that focuses on a person who wants to go into the field of mental health treatment or psychiatry. All right. So my next question is, you have attained the level of MD, medical doctorate. Is that correct? Am I saying that right? Okay.
Yes. That's what MD is, a medical doctorate.
Okay. All right. You also have a medical examiner's license. You have a medical license. So why you need both? I'm just as a layperson, why do you need both of them? What's the point?
So if I went to medical school, so the standard of medicine, the thing that really changed was in 1910, there was this Flexner report that got a German guy to come. He was an educational expert, and they were going to formalize and scientific, because Germany is always good at coming up with a regimen. A lot of the diets we have, Atkins diet, all this stuff, a lot of it comes out of German research. They brought this guy here and they shut down a bunch of med schools. There were like thousands of them. They had every small town had a med school, and they were just giving people a bag. There were a lot of quacks, guys with a bag of tricks, saws and poking, and they had to make it more uniform. So in the Black community, we lost a lot of our med schools. The two that survived were Meharry and Howard. They were doing it the most scientific base. And the model became Johns Hopkins. So they changed it so now I'm a doctor. I have a medical degree. What stops me from going on TV and making up stuff? The medical board. Because if I go on TV and I say some dangerous, crazy, reckless stuff, I'm going to get a letter from the medical board if I'm mistreating my patients. So the medical boards are there to protect doctors from themselves and to protect the community, holding doctors to a professional standard. So every year I have to renew my medical license in Louisiana. I can apply to medical license, and every state has their own process. But the gist of it is, it's usually a bunch of people that aren't even doctors. Largely, the medical board there's doctors on it, but they're not all doctors. And what they do, and under our board falls massage therapists and a bunch of other people, that physician assistants. But the goal is to make sure you're holding yourself to your professional standards, that you're doing your continuing medical education, because just because you graduated, you need to keep it up with what's going on now. You don't just keep practicing. I can't practice 2014 when I graduated from medical school medicine in 2020. We've learned things have changed. Corona affects how I prescribe in psychiatry, because every medicine, now you got to think about how it interacts with people who've already had corona. So the things, the changes it's done to their bodies. So it makes us think differently. The other thing about the medical board is, without the medical license, you're a doctor with a degree, but you can't practice medicine. So if you have a medical degree from Nigeria, you still have to come over and take the 3 steps. It's a United States medical licensing exam, USMLE. So there's step 1 we take after our second year. Step 2 they take after your second or third year. Step 3 you take after you did your intern year, and that gives you your permanent license. So when you graduate from med school and you get accepted into an American certified, what they call ACGME, American College of Graduate Medical Education, you get in one of those programs. It's a match. It's almost like the draft for the NBA. It's like the nerd draft. You get drafted into your field. You have some say so, and it's the nerd draft based on different factors. And the thing is, you do a temporary license when you're an intern. So you can write prescriptions or whatever, get your practice, your baby doctor. But then you get the big license. Okay. And that gives you your D. And when you get that, now you're responsible for what you do at a weight level that you weren't before. And it also, you get your DEA license as permanent. And these are the things that DEAs allows you to prescribe scheduled drugs like Adderall or pain pills or Xanax or gabapentin or Flexeril for people's backs and stuff like that. And at that point, once again, now you got another group of people, the DEA, they're watching what you do. Are you prescribing it appropriately? Are you prescribing to yourself? Are you prescribing to a bunch of people that are your friends that are always at your house? Are you prescribing to your spouse? And sometimes you have to prescribe to people you know, just because you don't wait and let somebody die because you don't want to do that. But it's to keep you up to standards, to keep that's why there's a bare line minimum quality that any American trained doctor is supposed to be able to meet, whether they're practicing in America, because if you go overseas, you still have to usually do a residency here. It's to get you to a certain place where everybody's speaking the same language. When I get somebody's notes, I can trust that this person has a certain level of knowledge. And that's the purpose of the medical board, is to kind of keep it keeps us honest with ourselves, and it keeps us challenging ourselves, because it's easy to fall into the same habits and just kind of, I don't want to read anymore. I've read enough stuff. I can never read another book again. But my patients need what's in that new work.
Okay.
So that's what the medical boards do. And that's kind of what our board certification boards do too. And that's just more specific on your field, because the medical board is what allows you to practice medicine. So I'm a medical doctor. If I didn't want to be a psychiatrist and I wanted to go work at urgent care, I could go work at urgent care, because after that intern year, you should be able to function relatively well as a doctor. But the main thing you learn in medical training is what you don't know.
Okay.
So knowing what you don't know is the most important thing to know when you're a doctor, to know when to stop and ask somebody else.
Okay. Dr. Turner, Richard, who are some of you mentioned Dr. Murray earlier, right? I believe you said Dr. Philip Murray, right?
Yeah.
All right. So you mentioned him in our interview, our pre-interview. You spoke of him highly. I'm mentioning his name a lot because he's a Howard graduate, so I'm gonna highlight that. So Dr. Philip Murray is one person who has assisted your thought process and kind of carried you through this work that you're involved in. Are there others that you comfortable naming?
There's a doctor, actually, she works in your region. Dr. Kimberly Gordon Achebe. She was one of the faculty members when I was training at Tulane. She's since left Tulane. Her and her husband, who was also a resident when I was a resident, Uche, he's a forensic psychiatrist. She's a child and adolescent psychiatrist, and actually she is the program director for the child and adolescent psychiatry program at the University of Maryland currently. She's a Xavier University grad, Tulane medical degree, training in psychiatry at Tulane, child and adolescent fellowship at Tulane. And she is amazing. She works, she is one of the best teachers I've ever had. She challenged us every day. She's one of the sharpest people, most relatable people I've ever met. And she's a blessing to that region to have her. She's actually does some news spots now. I'm glad to see it, because her brain is she's so community conscious, so equity, like making sure that we get everybody gets the same care. I've seen her treat people where offensive words that would normally make your blood boil are coming up, and she has this way she would turn it and get to what that pain is that's leading to this anger. And she was just one of those people she's one of the most bright people I've ever met. Like, she's just extremely, she's an amazing story. And another doctor I like to highlight is Dr. Denise Sherbington. Her and her husband both came to Tulane from Columbia. They were both faculty members and doctors at Columbia. Dr. Sherbington came, and she has multiple things she does. Like, now that she's kind of left Tulane.
One second, Rich. From Columbia University or from the country of Columbia?
Columbia University. She's training by ethnic background. But Dr. Sherbington is in New Orleans, and she has two programs. One is the Institute for Women and Ethnic Studies, which promotes access to mental health and emotional physical health in minorities, and particularly women. She also works with Institute for trauma informed, like she has an institute where they deal with violence prevention and trauma as it affects violence in the Black community, because a lot of the people committing violence have been victims of violence or have been affected by violence, and it creates a cycle of numbness that can lead. It's kind of like people wonder, how do these kids fight in wars in Africa and Haiti and in the streets of America and New Orleans? It's because if violence becomes normalized, it just becomes a part of background noise. And she's doing a lot of work to help people process their trauma. And especially since recently in New Orleans, they had an initiative called NOLA for Life that got in a lot of trouble because they were doing, kids would be exposed to violence. They were doing counseling and programs. But unfortunately, the police department had these people signing things they weren't reading, and they were using that knowledge to arrest those people's family members. They were using kids to identify their uncles and brothers and cousins. And that was a major setback in my city because the program in its essence and its conception was very good. But I was wondering why so many people like Dr. Sherbington weren't particularly involved in that. And it's partly because she didn't trust. She wants me to help. She wants to help you for you, not to stop crime. Not, it's good because healthy people don't tend to do things that are impulsive, that can hurt other people. But that should never be the focus. I'm not treating people for law enforcement reasons. That's the only time I do that is at the forensic hospital, because that's to keep people safe. Because some of my patients, when they're on their medicines, they're the sweetest people in the world. But off their medicine, I won't want to run into them when they're sick, and they wouldn't want to run into them when they're sick. And that's the goal. But Dr. Sherbington is doing amazing work. This lady has been practicing medicine since before I was a child, like before I was born, and she's still got all this energy, full of life. Her name is Denise Sherbington. Her like I said, it's the Institute of Women and Ethnic Studies. Google it. Denise, she's an amazing lady. And she mentors doctors. She got all the young African American doctors together, took us out to eat so we could all get to know each other, and so she could offer her counsel anytime we need it. And it's one of those things where you never know who you're going to encounter. And then there's some people that are very particular. I mean, like there's a lady, Angela Traylor. She's both a neurologist and a psychiatrist. She's a neuropsychiatrist. She wants to be a neurosurgeon. She's from Cleveland, down to earth, wonderful lady. One of the most brilliant doctors. Like she's one of those people where when people say her name, if she says something, all the doctors across the two-lane system like, oh, Dr. Traylor said that? Oh, okay. I don't even need to question because you know the diligence is there, you know the expertise, and you know that. And also, she's just the most charming human being you'll ever meet in your entire life. Like, you have watch a lady around Dr. Traylor. She may make her look at you sideways, like, wait a minute, why are you not charming like this doctor? You never noticed she was a doctor if you met her, but once she gets going, I've seen her change people's lives. So, but in the area you're at, if you ever need anybody who needs to see a child and adolescent psychiatrist, if they can see Kimberly Gordon, please go. She's amazing. She's just, and she's full of just life, and she loves her work. So that's the thing. The key to being a doctor is I don't just say people are good because I know them. It's because of the work they do. There's some good brothers. A good brother in Morehouse, alumni who went through Tulane. He's also an international DJ Diagnosis. Thomas Oden. He does work in Atlanta. He's from New Orleans, but he's St. Aug graduate. Went to Morehouse. Didn't go to Howard, which is his fault. Yeah. But then he went to Morehouse, and he's practicing. He just has teleservice, so he's available to people outside of the state of Georgia. But he's worked in Australia. He's just a well-rounded guy, great guy. He's really close with Philip Murray, actually. They're really good friends. So there's a lot of people out here that look like us more and more that are going into this field, which I think is a beautiful thing. I'm hoping more Native American brothers and sisters and more Latino brothers and sisters, which there is a good number of Latino psychiatrists, particularly Cuban Americans. There's a good number of them. But I want to see more and more people of all colors, shapes, creeds, backgrounds in our field, because it makes all of us conscious of things we might be missing, because I don't know the things I don't know. So, but those mentors that I have, those people I've encountered, I can name so many great doctors, but Dr. Sherbington always needs the shout out, and so does Dr. Gordon, because they're just amazing people.
Okay. And I just have one more question for you, and it can be brief. It can be, you can expand on it. But I asked you about this most recent question about people who you look up to, is because I would like to at some point talk to these people, if it's on camera or off, just because this mental health field is pretty exciting. I myself have gone speak to a therapist a few times a month. Had me a psychiatric evaluation, and I was so freaking scared. And I was like, let me just do it because hell, I never did it. You know, I want to try.
Right.
We try a lot of things in life.
Right.
We went to college. We tried Uber things.
Right.
We grew up. We tried a whole lot of things in high school. We
Right.
tried a lot of things after college. Try to get a mental health evaluation just to see how it works.
It's still scary as a doctor. Like when I'm working with these people, when you're interviewing for residency and you're thinking, I'm talking to a psychoanalyst. What are they thinking? Are they listening to what I'm saying? Are they watching what I'm doing? What are they thinking? What's the wheels turning? What are they going to say about me? I've seen guys who fought wars, heroes, like some TV movies should be made about them, stories, and they were afraid to see me. And I'm like, man, first of all, I'm honored that I even get to talk to you, because if you ever get to talk to a veteran, World War II, best ever. Korea, interesting. Vietnam, that's my dad's generation, so I love them. But World War II veteran tells you something, 100-year-old man full of life.
Yeah.
And you get that experience, but they're afraid to talk to me. And that's the thing. It's like, it's just unfamiliar. It's like the first time you go swimming or the first time you try food you don't like. And I tell people, going to a psychiatrist is like buying a car. You don't buy the first car you see on the lot. You test drive some cars. So if you get in a car and it's perfect and you know that, great. But if you don't like a psychiatrist or a therapist, that doesn't mean you don't need a psychiatrist or a therapist. That means that person can help you. And usually they kind of realize that too, and they can usually refer you elsewhere, or you reach out to your primary care doctor. A lot of them have go-to therapists and people too. But it's like y'all are both. It's a meeting. It's not not like you go to a surgeon and he's cutting on you and you're unconscious. It's an active process. And if you don't vibe with that person, I've walked in a room with people. And AA, this example is people at AA. I treat addicted people. They're sponsors. Some people want a sponsor that's just like them. Some people want a sponsor that's nothing like them because they're tired of the people that's like them. And so I've been helped by therapists. Unfortunately, disproportionately, there's not a lot of us. I've had therapists that I didn't think were going to help me a lot. They just helped me in a different way. And I've had therapists, because in psychiatry, they encourage you to do that. So you make sure you don't get because you take stuff in. That's the thing about being in a caring field. You take pain in with you. I carry around things that people have said, pictures I've seen, stories I've heard, and I have to make sure that it's not making it where I'm bringing that pain to somebody else. So kind of have a person as a sounding board. So some people think a therapist is like gonna fix you. Really what it is you have the operating manual for you. They're just helping you explore it. Because a lot of times we know things about ourselves, but we don't know what to do with those things. And sometimes those people allow you to see things as your weaknesses, as strengths, and help you realize that sometimes it's not you. It's the job. It's the person. It's the diet. It's not you.
That's right.
So, because there's nothing wrong with anyone. It's about what they do with themselves, and is it helpful or hurtful to themselves and the people around them. So if their life is completely fulfilled, I'm not going to come in as a psychiatrist and tell somebody, hey, man, you need to get on this medicine because you're too happy and you're too productive and you're too healthy and you're too happy with your marriage and your kids are too beautiful. That's not what we're there for. It's to help that person sometimes see that beautiful family, see that wonderful opportunity, see that they can use like a platform like this to change lives. That's what the field is for.
Man, look. So I got just this one last question, because you've been dropping a lot of jewels, and we talked about one award that you won, the Robert Columbus Lancaster Prize in Psychiatry. Is there any other award out there that you may be interested? You know, I want you to toot your own horn, man. You do what you want to do. You the medical doctor.
I would love to be the MVP of the NBA, but that's not going to happen. That was my goal when I was 11 or 12. But right now, the main reward for me is just seeing people do better and seeing my patients do better and seeing these doctors that come behind me be better than me and make a difference and find their place and what they're supposed to be doing in life. Because that's the goal of all of this, is to walk your path and figure out how to be the best you, the most optimizing yourself. If I was going to brand it, but that's not what it's really just finding a way to be authentic and helping people live their authentic, true selves in a way that allows them to be happy and feel like where their gifts are able to be freely used because they're not held back. So the reward and the award for me, more than money or anything else, is seeing that I'm actually seeing people do better and help be better, and be better to other people. So, of course, I would love to, if there was an award that I could get in psychiatry, it would probably be something more related. My next goal is probably try to get some awards for more community level psychiatry. I want to do more work in churches and going to Christian men's groups and gyms and just barbershops. And because I did a little bit at my barbershop, and we had little forums and people asked me questions, people asked me to do stuff. But the major reward is making sure I don't waste this stuff I did pick up and people who can use it and do it better than me. Because there's always, it's just like I was watching the All-Star game and Allen Iverson said these guys are better than me. The kids coming behind us are going to be smarter. They're going to be, they have less of a stigma on mental illness that even they have to fight through. Because some of the awkwardness I have sometimes is their stigma. I understand it because I had that same stigma 10 years ago. So these kids don't have that. So at the VA, it used to be beautiful to watch the young vets help the old vets talk about their feelings because the young vets are used to talking about their feelings. So the old vets are like, whoa, this young guys, what are they talking about? And it was a thing that made me realize that the greatest award you could have is the work that you do in your life and what it leads to. And that kind of comes from one of my mentors, Dr. Carr, who teaches chair of African American Studies at Howard. He tells us, because he's like, he doesn't have kids. He's like, I have kids. I have thousands of kids, and they have thousands of kids. Because everybody I've taught and everybody they've taught, we're all connected. And it goes back to like, we're all in the same genealogy of people who are trying to make things better for our community, and people who are trying to be just better humans. Because at the end of the day, it's about humanity. And so your legacy is what you leave behind. Who were you to people? Whether anybody comes to your funeral to say something, your reach is bigger than you ever could know. Because every person you encounter, you have an opportunity to do something that can make them better and make you better. So that's the award that I want. The award for having done a good job in my life.
Okay. And so with that being said, you all, we have had the honor and the privilege to be here with Dr. Richard Turner. He will not be a stranger to this show. Hopefully he's not a stranger to the other, because we have I'm gonna say a plethora. We may have like 15, 20 other hosts. We have a mental health track on the network. We have just a lot of different hosts who talk about a lot of different things. And so I would like to bring you back, at least for this show, at some point in the near future, because you just laid down, you dropped some laws, man. I'm gonna just say that. You dropped some laws now that I'm gonna see. I'm gonna go back and watch this, and I'm gonna learn some things for us to discuss in our next interview.
And I got some folks that if you want to talk to, they got the brother who I know, he's got his Ph.D. recently. His name is Lionel King, also known as Asad Malik, Muslim brother. He did a dissertation on cognitive behavioral therapy incorporating religious elements and spirituality. So that's some dope stuff, man. This dude is amazing, dynamite. Like it's and also he's a great father, great husband, man of God, man of honor. Like he's a great man. So I'm gonna try to link y'all up too. I think you'd like him a lot, and I think he could help a lot with your audience and just that whole, because that's another connection we could talk about another time. Is that faith and mental health treatment are not in conflict at all. If church is good for you, I encourage you to go more days a week. Better than doing other stuff. If church is good for you, keep doing it, because there's no substitute for things that are more powerful than all of us. So please understand that we can have a whole conversation on that, how a lot of Black folks, that's one of the other things that people think that we're going to try to pull them away from their faith. Most psychiatrists are religious people. Most doctors are religious people, and particularly Black psychiatrists. A lot of them feel like it's almost like a vocation, a mission from God. Like I have a classmate, that's a big focus. Her spirituality, it just pours through her own work. So
okay. Well, with that being said, we hit the hour mark. I'm so excited. We didn't have to pull teeth to get information. We didn't have to do anything out of the ordinary, but just ask questions and listen to the man, the myth. No, he's not a myth yet. The man and the legend. My brother from Howard University, Dr. Richard Turner, representing Louisiana. Next week, we will be back for the final day of the month of February. We will be discussing mental health. Hopefully, we'll be discussing mental health once again. And until next time, this week, the network blackusa.news, there we will have called the Joe Mans Award. Awards will be offered to hosts as well as guests, as well as people who are privileged to win this award out of the Baltimore area. Whoever's coming, we'll have it in Baltimore. I'm definitely looking forward to going. And I pray for me. I might win an award. I'm wearing my nice jacket, so I might bring some luck upon myself.
Let me know, man. We can celebrate.
Right, for sure. and until next time, we will talk to you all. Have a good day. And until next Monday, 8 p.m. Eastern Standard Time, this is the Robaer Report. My name is Robaer Washington. Have a great rest of your week. Take care.